Hi everybody, it's Dr. David Gustitus again, talking to you today about ways that we can help you with low back pain. The most important thing that we do here at Rhythm of Life Chiropractic is that we take a different approach. No drugs, no surgery, just the body healing itself. We want to help you avoid unnecessary drugs, unnecessary surgery, and just remove the interference that is preventing your body from healing itself. Now, when it comes to low back pain, the most important thing we need to do is start with the proper roadmap. If we have a map of where you are, we know that you're in pain, but we don't know what normal is and where we're supposed to be heading. Is it just mask the pain, cover it up with a medication, or we have a clear destination of what normal, proper function should look like and should be for you? If we know that point A to point B, then we can set up a program together, set a course for that target, and then we can work towards that target. Without that, then we're lost. So what we do most importantly is do a proper assessment. We want to see where the problems are, what is going on in the spine, what is going on in the nervous system, and really what is causing this low back pain that you're experiencing. Behind me, you can see these x-rays. You can see a normal x-ray of the lumbar and pelvic region of the spine with a properly balanced, symmetrically aligned lumbar spine and pelvis. Over here, to my left, you can see the red line that deviates from that green line. In this case, this patient has a tilt in their pelvis. They have a shift offline of their lumbar spine. They have an angle down here and an angle up there going away from that green line. And what that does is starts to put pressure, distortion, irritation, stretch, and otherwise interference to that nerve pathway that goes right through the spine. So just remember that the spine is the conduit for all things coming out of the brain. And if the spine's openings, if those holes that carry the spinal cord and carry the nerves out to their destinations, if that opening is occluded or somehow interfered with or blocked by a misalignment, then that's going to irritate those delicate nerves. And when that happens in the spine, it's called a subluxation. Subluxation is what chiropractors look for, and we detect it, we correct it, and we try to let the body heal as a result of correcting that subluxation. A subluxation is like a blown fuse. It's like when you have too many plugs going into the outlet, then what happens is after a while it'll blow. It'll exceed its capacity to handle all that electrical demand, just like our body can only handle so much bending, so much movement, so much stress, so much chemical interference. These are all things that can contribute to a blown fuse in the spine, which we call a subluxation. So when a misalignment happens, when you have a normal vertebra couple that misaligns, if that vertebra starts to interfere with, or that misalignment starts to interfere with the normal nerve transmission, then we can have pain. We can have that pain occur instantly from an injury, or it can come over time because that area started to wear and tear and degenerate. As you can see in this model here, it starts to thin the disc, and over time, when it gets really bad, you see degeneration, thinning of the disc, and withering away of these nerves. It's very, very important that you get a proper assessment of the spine in order to know where you are properly aligned and where you are misaligned. Chiropractors are experts at doing that. In our office, we have a digital x-ray analysis system that we utilize to make a proper initial assessment on every single patient so that we know how to properly set up a course of recommendations and get you well. If you have further questions about this, and if you'd like to explore any of this with us, we'd love to help. So just look at this link below, click on that, and we'd love to be able to help you get over your low back pain.